Yes.
Hello, hello, hello. Testing, testing.
So be talking to the graft the way we talk.
Testing.
Testing.
How are you?
I'm good.
Aha.
Привет, друзья. Привет из Африки, Гана. Сегодня у нас другая интересная встреча. Другом нашей семьи. Сначала хочу с ним познакомить мою аудиторию. Hello.
Hello.
Please, how are you doing?
I'm good. How are you too?
I am also doing fine, thank you. So I wanted my audience to know who you are. If you can introduce, please, your name.
Yeah. My name is De Graft. I work as a doctor at the Bolgatanga Regional Hospital in the Upper East region.
Thank you. Я спросила просто его имя Де Графт, и он работает в больнице, он врач. Начнем с первого вопроса. Хочу узнать, сколько лет учатся студенты на врача, на профессию врача. So, please, De Graft,
Yeah.
let us start with training of the doctors. How long does it take in Ghana to be trained as a doctor?
Yeah. So, when you are done with your secondary school education, then you go to medical school for 6 or 7 years.
Okay,
Yes. So, let's say basically 6 years.
okay.
Yes. And they have a different program called the graduate entry. So that one is for those who have already done their first degrees. Some schools offer that you do extra 4 years. So that means 8 years in total.
Okay.
So all in all, it's between 6 to 8 years depending on the path that you choose.
Okay. Ответ таков, что в зависимости, как ты поступил, может быть от 6 до 8 лет учеба в медицинском институте.
Мой второй вопрос таков. Если врач приехал из другой страны, может ли он сразу работать, опираясь на свой диплом, или что-то еще нужно?
Okay, so my other question is related to doctors who receive training in other countries and now they came to Ghana. Can they start practicing right away with their respective certificates, or there are some requirements for that?
Okay. So you cannot practice usually straight away when you train in another country. And that is so for almost every country.
Okay.
So when you come to Ghana, for example, your documents need to be sent to the Medical and Dental Council of Ghana.
Okay.
And then they will evaluate your documents to see if you got the education that they want you to get.
Okay.
Then usually you will do an internship. Usually the internship is for 1 year.
Okay.
And then when you are done with your internship, you sit for an exam. It's called the Medical and Dental Council License Exam.
Okay.
So when you take that exam and you pass it, then you have an induction ceremony into the Ghana Medical and Dental Council, and that's when
Okay.
you can start to practice medicine in Ghana.
Okay. So there is a process doctors trained abroad should go through before they are allowed to practice medicine in Ghana.
Редкие случаи, когда врачи приезжают из-за границы, пишут этот экзамен лет 5 и работать не могут, пока его не сдадут. И вопрос, есть ли разница между ганскими врачами и теми, что подготовлены в Европе?
Yes, so it is said that medicine is universal. So let's say generally the knowledge that you get is the same. But as we both know, there are some diseases that are more common, example, here in Ghana than it is in Europe. And it's also there are more diseases that are more common there in Europe than in Ghana.
Okay.
So that's why you need to take the exam here, so that they are sure that what you need to know for the diseases that we have here,
Thank you so much.
you have it.
Я хочу перевести. Он говорит, что дело в том, что в зависимости от места проживания людей болезни тоже разнятся, хотя, в принципе, медицина как наука, она универсальная.
Поэтому-то и нужно подтверждать этот диплом, чтобы врач мог доказать, что у него есть знания по лечению африканских болезней.
Хочу узнать у него, он сейчас начал работу врача, в чем его работа заключается в Гане, что он именно делает. So please, Degraft, I want to find out. You are now practicing as a doctor,
Yes.
and would you mind to give us small light or throw us some small light about your work? What do you do?
Okay. So there are three main parts of our work. We have the emergency work. So usually you stay in, when patients come in with various emergencies, you manage, you stabilize.
Okay.
Some would have to go to the theater for surgeries. We work on that. And then there's ward work. So mainly there are patients who are admitted on the wards. So you also have to go and review them, see how they are doing.
Okay.
If they need to change their medication, if they are getting better, they can go home. That's also good. And there's also outpatient department. So you are in an office, a consulting room, and then patients come in, they tell you there's something wrong, you ask them questions, find out what it is, and then give them some medications to go, or sometimes they come on review. So that's mainly the work that we
Thank you
do.
so much. So practically, what areas of medicine have you been exposed to?
Повторю вопрос. С какими областями медицины ты столкнулся?
So in medical school, you are exposed to all the areas of medicine. In Ghana, after your medical school, you have something called your housemanship that you do for 2 years. So during those 2 years, you spend 6 months each in a specific department. Yeah, there are 4 main departments and other departments that you can do. So we have general surgery, internal medicine, pediatrics, and then obstetrics and gynecology. Sometimes you might opt to do other things like psychiatry or anesthesiology. But all in all, we work through many different departments
Thank you.
while we are in school and also during our housemanship.
Хочу сейчас узнать, когда у них специализация начинается. What about specialization? When do you usually specialize?
Okay, so with the current program in Ghana, after you do your housemanship, you start working as a medical officer. And when you're working as a medical officer, then you usually have exams that you write called your primaries. It's also organized by either the Ghana College of Physicians and Surgeons or the West Africa College of Physicians and Surgeons. So when you write your primaries, you write them, they are specific for the specific specialty that you want to do. When you take the primaries in that specialty and you pass it, then you go for an interview, and then you enroll in a residency program. So residency program, usually there are 2 parts of it. Yeah, so the first part is usually between 3 to 5 years.
Okay.
So when you're done with that, then you become a specialist in that particular specialty.
Can you do specialization solely in Ghana?
Yes.
You can do.
Yes.
You have that opportunities to specialize in Ghana.
There's a Ghana College of Physicians and Surgeons. So the Ghana College is responsible for training specialists.
Very good.
And then you can train as a specialist in most of the teaching hospitals in Ghana. Yes, so all those opportunities are available.
Значит, специализация в Гане по любым направлениям возможно. То есть можно чисто в Гане выучиться и быть специалистом в любом направлении медицины. Okay. Сейчас спрошу, есть ли частные клиники в Гане и отличия частных клиник от государственных. So, please, Degraft, do you have private clinics in Ghana?
Yes, there are private clinics, there are private hospitals that are in Ghana.
Okay, thank you. So then what is like the major differences between a governmental hospital and a private one?
Okay. So I'd say the main difference is ownership.
Ownership,
Yes,
okay.
the government one obviously is controlled by the government. private one is either one person or a group of individuals that come together to make it a clinic. Yeah. And other differences include, for example, cost. So many times the private clinics are more expensive than the government. Another difference has to do with time. Because the government clinics have more people going there, you are likely to spend more time in the hospital if you go to a government clinic because there are more people to be seen compared to the private clinics. And the other difference, which might not be very clear to the outsiders, the degree of specialization. You are likely to have more specialized services in the government hospitals, and that's because sometimes or many times it's more difficult for the private institutions to pay the most specialized doctors. But it also happens there are lots of private hospitals that have very specialized doctors, but as you know, that will come at even a higher cost than it will be to see a specialist in a government hospital.
Деграф говорит, что есть разница между, конечно, частными больницами и государственными. Ну, понятно, что цена. Но дело в том, что касательно специалистов, лучшие специалисты всегда будут в государственных больницах, чем в частных. Потому что не всегда можно найти хорошего специалиста в частной клинике. Ну, это обычно может быть там один человек или несколько. А в государственной целая команда врачей. Хочу узнать вообще, медицина в Гане – это дорого или позволительно для граждан? So please, Degraft, I want to find out, in your view as a doctor, though of course I have my view as a patient as well, but in general, medical care in Ghana, is it expensive or affordable?
Okay, so in my view as a doctor, also looking at the general conditions of my patients, I think medical care in Ghana is expensive.
Дорого, говорит, что дорого.
And that's not because the care itself is too expensive or more expensive than it should be, but we have a health insurance system that does not cover many diseases and many.
Значит, он объясняет, что дорого не потому, что специалисты дорогие. Специалисты, в принципе, здесь недорогие. Кост страховки. Он не покрывает все болезни. И большинство серьезных болезней не покрывает. Получается, что человек должен платить сам за многие серьезные вещи.
Yes. So even though the health itself is not very expensive compared to some countries, if you look at the standard of living here, how much people earn all in all, and how much healthcare costs, and coupled with the fact that many of them, even if they have insurance, still have to pay for a lot of things, then I would say I think healthcare in Ghana is expensive.
Okay, thank you. То есть он делает сравнение, что в других странах за границей цена даже выше, но дело в том, что это же все зависит от сколько люди получают в среднем в стране и сколько они платят за медицину. Поэтому он говорит, из-за того, что у нас люди, средняя зарплата здесь ниже, чем в Америке в той же.
Поэтому, по его мнению, цена за медицинские услуги в Гане высокая.
Ну, а теперь мы отвлечемся от медицины. Хочу просто узнать от Деграфта как о человеке что-то интересное. Хочу узнать о его интересах. So please, Degraft, let's put the medicine aside.
Thank you.
You're welcome. Let me find out, what are your other interests, perhaps hobbies in life?
Okay, so I have a wide range of hobbies.
Okay, он говорит, что у него очень много hobbies.
Yeah, so when it comes to sports, I like to play tennis. I like basketball. I like football.
Теннис, баскетбол, футбол.
And I like to watch athletics.
И смотреть тоже он любит атлетику.
Yeah.
Wow.
And then when it comes to other things like literature, I like to read and I like to write.
Он
So,
литературу тоже любит. Он любит читать, любит писать.
yeah.
You write your own stories.
Yes, I write my own
Он
stories.
даже пишет свои рассказы.
Yes. My stories, then poetry, my
По-
experiences.
Стихи,
Yes.
свой опыт жизни он тоже описывает.
Yes. So I enjoy that too. And aside that, I enjoy photography. So taking pictures and trying to get nice shots and nice angles. I enjoy that
Понятно,
too.
он тоже любит фотографии.
Yeah.
Фотографии как просто предметы интереса природы.
Yes. And then I like music. I really like music. So
Вау.
um,
Музыка тоже его хобби.
so
To listen, to play,
to listen.
to listen.
Mostly to listen.
What
to
kind of music do you listen?
Oh.
Is it classical one? Is it pop music? Is it both?
When it comes to music, I like the words in the song most.
Mhm.
So music that I can listen to and
Okay.
understand and enjoy the words in
Okay,
it.
thank you.
That's it.
Говорит, что в музыке ему больше нравится там, где есть слова, чтобы он понимал их смысл, и именно смысл приносит ему удовлетворение. What about languages? Do you have interest in languages?
Yes, I have interest in languages. So I was born in Ghana. I speak English and then I speak Chi. So those are the languages that I speak best.
Okay,
Yes.
just a second. Спросила у него, есть у него интерес к языкам. Он говорит, да. Прежде всего он родился в Гане. Естественно, что он знает английский и знает местный язык Чуи.
Yeah. And the other languages that I know how to speak and I understand to an extent, even though not as good as English and Chi, are also French and German.
Вау.
So,
Значит,
yeah.
он назвал, что два других языка, на которых он может говорить и понимать, это немецкий и французский язык. Wow.
Yeah.
Such a wide interests areas.
yes.
Wow.
That's why I enjoy it.
So then I think we can round up our interview, and I
Wow.
thank you so much
Thank
for
you.
giving
too.
us time
Yeah.
and visiting us in Navrongo.
Thanks for having me. It's a pleasure being here.
Друзья, скажем вам до свидания. И please, the ground, which language do you want to use to say bye-bye?
So I think I'll speak German.
Okay.
Okay. Bis später. Wir wollen einander mal treffen.
That is German, немецкий язык.
Yeah.
Thank you.